Welcome to Rebel Health Collective Podcast, where we're not just talking about health, we're transforming it. Here at Rebel Health Collective, our mission is simple but powerful. It's to advocate for you and your health rights, educate you with reliable information, connect you with a community that understands, and inspire you to take control of your well-being. Join us as we explore courageous health journeys, challenge the status quo, and empower you to be at the center of your healthcare decisions. This is more than just a podcast, it's a movement. Together, we're building a world where everyone has the knowledge and support to live their healthiest lives. Please note that the information shared in this podcast is not medical advice and should not be treated as such. Our goal is to share stories, open up new ways of thinking, and inspire action in your health and well-being. Always consult your primary care team before implementing any new care protocol into your regimen. If you like what you hear, don't forget to like this episode, subscribe to the podcast, and follow us on Instagram and Facebook at Rebel Health Collective. Now let's dive into today's episode. We have an incredibly inspiring guest joining us, Gilanie, a dedicated oncology nurse with over 20 years of experience. Gilanie isn't just on the front lines of patient care, she's also leading the charge in nursing advocacy, fighting to amplify the voices of nurses and patients in the healthcare system. In this episode, we dive deep into the critical roles that nurses play in shaping healthcare and how both healthcare professionals and patients can use their voices to drive policy change. Gilanie shares her journey from being a nurse focused solely on patient care to becoming a powerful advocate for legislative action. We discuss practical steps on how you can get involved in advocacy, the importance of civil engagement, and how policy changes can directly impact patient care. Whether you're a nurse, a patient, or someone passionate about healthcare reform, this episode is packed with actionable insights that will empower you to make a difference. So get ready to learn how we can help transform healthcare from the ground up. Let's get started. All right. Welcome back to another episode of Rebel Health Collective. We have a very exciting guest here with us today, someone who is outside my autoimmune disease sickness circle. So very excited to learn something new. And selfishly, I could just have this conversation with you and not publish it, and I would be totally fine with that because I think you have a lot of insights and I'm really excited to hear from you. Without any further ado, I'm going to turn it over to our guest, Gilanie.
Hi, Josh. Thank you again for this opportunity to be on your platform. And this is the power of social media. I've made so many great connections that turned out to be great friends just through my social media accounts because of what I want my message to be and my mission out there about advocacy and how nurses and generally in healthcare, how people can make a difference outside of the hospital or outside of their place of work. A little bit about me. I'm a registered nurse. I'm from California. My specialty is oncology nursing. So I do know a bit about autoimmune diseases and things of that nature. So I've been a nurse for over 20 years and I've really enjoyed being an oncology nurse. My current mission is really, as I mentioned, to get more nurses involved in advocacy and advocating not just for their patients, but for our profession so that we do have a louder voice out there and so that we have more influence in how the healthcare system works and policies that exist or future policies. Just a little bit about how I got started in it. And again, I was a nurse just going along my regular nursing career, not really interested in politics, never one of those people to talk about politics or policies or anything like that outside of just like general knowledge or whatever I heard in the news. But in 2020, things changed for me. And as you recall, that's when the pandemic really started gaining more widespread outbreak in the United States. And me being in California hit us coming from Asia or the West for us that way. It did hit our shores first over here. And like everyday normal people, I would hear about it in the news. Maybe perhaps I was a little more in tune to it because I was in healthcare because I would hear about challenges that hospital systems were having or outbreaks that were happening. So that really led me on the advocacy journey because I don't know if you recall, Josh, but there were stories about PPE shortages and some people like didn't even know what PPE was or the emergency rooms being overrun and things like that. So, being in oncology, we use PPE, gloves, eye protection, gowns, everything when we're hanging chemotherapy, when we're handling hazardous materials like that. At the time, I was a supervisor in an infusion center, and it was really a struggle trying to get protection for my staff and the nurses and following the chain of command, wondering what our higher ups would have for us to basically protect us, right? You go up the chain of command, see how they can keep us afloat and going, and making sure that we can do the best we can for our patients. But the CDC was out in the news like almost daily, and there were recommendations they had that seemed to change almost daily,
Yes.
sometimes hourly.
Yes. Definitely
And
remember.
it was very frustrating because for me as a nurse, especially as a supervisor at the time, I was responsible not just for the care that the patients received, but also for my staff. And I didn't know how to protect the patients. I didn't know how to protect my staff. I didn't even know how to protect myself and my family. I think all of us were going through the same thing. And it was really disillusioning as someone in healthcare because was thinking, and I think many Americans probably have this thought that there's someone that's going to be there to take care of us when there's a natural disaster or there's a pandemic. At least in my lifetime, I don't recall having to live through something like this, but just the thought of there's someone that's going to be there to catch us, and just realizing behind the scenes in healthcare that there was no one to catch us. And I don't know how that looked like for patients looking from the outside of what we were dealing with, but also too, it's you want to be transparent with your patient population, but at the same time, it's like you do want to protect them. One guiding principle as a nurse is that in an emergency, you stay calm so your patient doesn't panic. Because if you panic, then
Right.
patient panics, family panics, and it's not a
It's
good
all downhill
situation.
from
So
there.
yeah, it's all downhill. So I equate it to that. It was this catastrophic situation. As healthcare workers, we had to stay calm, and as a leader to my staff, I had to stay calm. But really inside, I was like, what the heck is happening? What do we do? And I say this a lot in my talks and people I speak to, but that was really my Wizard of Oz moment where I had this belief that, especially for the healthcare system, it's one of the vital systems that keeps this country going, that somebody would catch us. There'd be a safety net. But really, it was finding out that the man behind the curtain wasn't some great and fabulous wizard. It was just a regular man who was just making things up, and definitely not who or what I expected. And I went through a period of not just disillusionment, but just anger. Not anger at the government, not anger at institutions, but anger at the nursing profession. And I would say that kicked off my journey because it made me realize that we did this to ourselves as a profession. We, for the most part, like I said, I was never involved in politics, never talked about it. Many of my colleagues I know throughout the years, generally, that's just not how we practice. We're there for the patient, and we carry out the doctor's orders, and we use our critical thinking and our training to do the best we can for the patient. But my mind, like policies and getting involved and influencing policies and healthcare were parallel and not really intersecting. So that was my naive view. So again, like the anger I had for the nursing profession was that how can we, a profession of, at the time in 2020, 2021, there were 6.5 million nurses in the country, do this to ourselves? Like, where were our leaders in our profession? Who was there to speak for us? Because in speaking for our profession, that trickles down to how we carry out care for our nurses. And I say this almost every time I talk because it surprises myself, but that was about 4 years ago. And I still feel that anger and that passion when I talk about it now, because to me, it was like really dumbfounding. Like we have all these very well educated nurses out there, PhDs, DNPs who are doctorates in nursing practice, researchers, very skilled bedside practitioners or clinicians, and yet we were really letting the fate of our profession be handled by someone on the outside.
When
Yeah,
you say outside, do you mean like outside
yeah,
the nursing industry and that chain of leadership you're talking about?
Yeah,
Just
yeah.
would that be like a senator, a congressman? Who would that be for you guys?
I guess at the time I really didn't even know, and that's part of the anger I had with myself. I'm like, I don't even know
Who
who
to be mad at?
who to be mad at. It's like, okay, the hospital system, all the hospital systems were going through it at the time. Was it the CEO, the president of the hospital, the CNO? Was it the CDC? Was it like who would be in charge? I started doing my research, and what it really led me to was that there was very little that was representing us from the outside. I've been part of nursing associations, like I was part of the Oncology Nursing Society, American Nurses Association, but that was just mostly as part of my profession, like what I was part of to learn more about how I can improve my skills as a nurse or find out what's happening in the profession. But again, too, that was just more, this is my title, this is what I signed up for, this is like kind of the package that you have in your profession.
Yeah.
But yeah, I was trying to figure out who was in charge of us or who was representing us. And just really came down to the realization that at the time there was really not a voice for nursing. And it's up to us as a profession to be a voice. And even in my research, I didn't find many nurses that were out there making change or raising their hand up and saying, wait a second, this is what we need, or this is how it is in the healthcare system. And then I realized, like in Senate and whether it's the state or the federal or in local government, you have physicians, politicians, attorneys, businessmen, sometimes someone with not a professional background. They want to represent their community. They want to do public service, but it's a dichotomy because it's yes, you're a nurse and you want to serve your population and your community in healthcare, but if you step out of that and start representing in these arenas where laws are made, policies are made, it takes you away from that space where you're representing the patient. At least in my mind, again, I had a very narrow worldview of the time of what nursing was in terms of policy and healthcare and government and all that. But then again, I was doing more research and I came upon this webinar where they're talking to a representative from Florida, and it was Representative Shalala, and she said, just offhandedly, there's 6.5 million nurses in this country. Imagine if they voted as one on one topic on healthcare. That would like instantly change policies and help communities in a short period of time because there wasn't a large nursing voice in Congress. So that really set off another light bulb in my head. I'm like realizing, okay, let me do what I can to represent the nursing profession. And I started aligning myself with nursing organizations that had advocacy groups. And usually in these advocacy groups, they advocate for whatever specific patient population that they're looking at. For example, I'm an oncology nurse with the nursing society I was with. We advocate for oncology policies
Okay.
and make sure we improve like chemotherapy delivery, safety, all of that stuff. And same goes for the American Nursing Association. So they talk about safety for our profession, but also how we can provide quality healthcare for the patient. So I think it was very inspiring to see that there were nurses out there, there were organizations doing this, but they weren't linked to each other necessarily. And so I wanted to see how I could link these missions together and just get the word out there because I felt like we can't change the system from within the hospital walls. We have to go outside. And when I say hospital walls, it just means wherever the nurse is at that moment, because nurses work in different environments. But wherever the nurse is at that moment, like we have a responsibility to bring our stories, to bring our experiences to the people that are making decisions. And if not to the people making decisions, and we have to bring ourselves to the table so that we can have influence and be a decision maker. There's this quote that I hear a lot. It says, if you don't have a seat at the table, then you're probably on the menu. And there's really truth in that because if you don't have a voice, you don't have representation. then people are going to be talking about you, people are going to be making decisions on your behalf. And why I wanted to approach it from the angle of advocating and empowering the nursing profession is that when nurses are empowered, when nurses have what they need so that they can practice and deliver the best quality healthcare they can, patients directly benefit. And I'm not discounting the work of physicians and the allied health and everybody in the hospital, but for the most part, nurses are there for the majority of the healthcare journey, like right along with you, right? I don't know if you've had any family members hospitalized or anybody you visited in the hospital, but if you have any needs that need to be communicated to the physician, the speech therapist, physical therapist, dietary, anybody, you go to your nurse. They're your representative.
Right.
And we have a professional code of ethics that really puts the patient first. And you go into nursing for, I think it takes a special personality, special disposition to go into the nursing or healthcare field, right? You want to help people to begin with. It's never about what can I get out of it first before I help the patient, before I help the family. I think because of our code of ethics, because of just the desire to help people, we're really primed to have a voice in government or places where policies are made. And how we can partner with patients in this is that patients have the stories, like they have the experience. I've had very close family members that have been through healthcare challenges. And I think, man, if I wasn't a nurse, like I wouldn't know like how to navigate through this. What kind of resources would I be? Like I have that kind of inside advantage just because I know how the system works. But just knowing that millions of people out there don't know how the system works and just will take it at face value and just go along with it. And it's really tragic because it shouldn't be that way. It shouldn't be like, oh, I know somebody that can help me or know somebody that works at this clinic or this hospital and I can get my care faster. It shouldn't be like that. And patients become very, and speaking for myself, I also do this with my health journey, is we become very savvy in how we have to advocate for ourselves as patients. And I remember when I was in my supervisor role and I was working with patients directly, hearing about the appointments you have to make and specialists you have to see and trying to coordinate everything, whether you're doing it for yourself or for a loved one. It's a full time job and it's a very steep learning curve. Because also, if you're talking about healthcare insurance, I'm convinced that they make it difficult on purpose.
Oh, I can vouch for that. I have been on probably 60 hours of health insurance calls trying to get an insulin pump. So
Yeah,
I can vouch for that one.
it's very frustrating. And I feel like as soon as you figure out, okay, these are the rules, the new year comes around and everything
All
changes,
different.
all different. And I think that the time spent in just coordinating the care that you need or your family member needs is better spent being with your family member, like having a good quality of life and not being on the phone or paperwork or just dealing with really red tape. And I have to tell you too, as a nurse, working with nurses that deal with insurance companies, it's the same thing too. It's we may have like a special button to press, like if you're a healthcare provider, press this button, but it's still like hours of
Different line.
being on hold.
It's probably
Yeah,
the same people
yeah, they,
answering both hotlines
that's
that
right.
I wouldn't want to trade spots with because I'm sure you're not just handling one case, you're handling multiple patients' cases, and they're all really important because they're all seeing you for a reason. They're not just coming in
Yeah,
just to have their ears checked or something like that. They're there for care now.
yeah, that's right. It's all emergent, right? It's all urgent. And I think the advantage of being in healthcare and doing, for example, the calls to the hospital, like prior authorization, things like that. It's just that a nurse in that position does it over and over again, and maybe you build relationships and it can be a little faster. But knowing that still the majority of it falls on the patient. And I remember in my mid-career years when I was talking to patients, like I was telling them, this is what I can do for you, but you're your best advocate. The insurance company won't even talk to us about certain things. They need to talk to you. Like I can help guide you on the system a little bit, but it's still up to you. And I was thinking, that's really so sad where you have to be the best advocate for yourself when you're not feeling good, when your family member is not feeling good, and you're dealing with all the stressors of that. Now, do I know how to change that yet? I don't, but it's my goal. But I really feel like the more voices we can have in that conversation, the more representatives we can have from nursing and even partnering with patients. I think that's where it's really going to change, like the grassroots efforts of things. I have a good friend of mine who I met again just through my one of my organizations, and she's a patient advocate. She went through chemotherapy, and she helped pass legislation in her home state for egg preservation, fertility, health, and egg preservation because the type of chemotherapy she was on, and she's younger. She wanted to have the opportunity to have kids when she was older, but there was no legislation in her state at the time. So she partnered with her social worker, and it was amazing and really inspiring how she got that passed based on talking about her experience, testifying to Congress about what she went through, not just her, but patients going through this, what they have to go through, and really making people understand that it was something needed. And at the very basic, that's what it takes is talking to the people that have the power to change things and telling them our stories. And through your platform, I see your story and what you're going through, and I learned from it too. And again, if you're not out there educating, if you're not out there talking about what the needs are, how will people know? There's so many competing voices. And it's not, I wouldn't say like ill intention, oh, we're purposefully preventing these people from having the care they need. It's just that there's so many competing voices out there, so many people that might have more knowledge than I do or you do and are at the front of the line first. And that's unfortunately just how our system works right now. So it's about educating ourselves, educating those around us, building communities, getting the momentum moving. And I think that will go a long way in changing healthcare. And another way to that is if Monday morning you and I decided to run for state senate in our respective states, that might have something to do in changing healthcare. But there are many options to change it, but at least what anyone can do, me and you can do, is talk about our stories, talk about what the issues are, what the problems are, and possible solutions. And in my platforms, I have a handle called Citizen Nurse, and I'm on several social media platforms.
And all of
Yeah,
those in the show notes. So the YouTube,
thank
Instagram,
you.
all of that will be on there. So if anybody's looking to get more informed with your platform, the resources will definitely be there.
Thanks, Josh. Thank you. And yeah, I think social media is a great way to get your message out there because most people are on there. At least the target audience I want in terms of nurses are on there. And because people who get it, like people that know that there are problems, there are issues, this is the path forward to fix them, those aren't the people I want to talk to because they're already doing something. They're already on a mission. They already have the knowledge. I want to talk to the people that don't even know, as far as nursing, that we can do this, that we have a voice, that we have it within our professional scope of practice to advocate not just for our patients, but for ourselves, getting them to know that we can do this. And it's about meeting people where they're at. And I think that's what you do with your platform as well, is you bring stories out there so people are aware that there are problems and there are issues out there. And it's not one or two or three people going through it. It can be thousands and millions. And I'm sure you've heard in the news recently, like insulin coverage, right? It's always been a hot topic. Millions of people need it, rely on it just to continue with their lives. And should it be as complicated as it is? People need it, let's give it to them, but there's all these things that seem to be like hurdles along the way. And speaking as a patient, or speaking as a patient advocate, knowing how to tear away or bring down the layers that are confusing or distracting, so that your member of Congress or your local officials know what the true issue is. I feel that's our responsibility as informed citizens, and really educating our politicians and each other. I got distracted, but I was going to say, with my platforms, that's one of my big things, is civic engagement, is that in order to make any changes in healthcare, and even if you're someone that does healthcare, I'm not sick, why should I be interested? Whether you like it or not, it affects you.
It does.
It's affecting your community. It's affecting, maybe not you now, but maybe next year, in 5 years, or it's somewhere along the line, one of your loved ones or yourself is going to get affected. And it is, I feel like, our civic duty to really be aware of our issues that are happening in the community. And if you don't have the time or the knowledge, partner with people who are advocates like you, Josh, or speak to your doctor, your nurse, somebody that works in the healthcare field. People are always wanting to learn and hear stories, and that's where it starts. It really matters. It really matters, like in anything. When I heard about your story and what you're doing, it really inspired me, really, to keep going on with my message, because if people who are going through a healthcare challenge are inspired enough and pushed to the point where they're like, you know what, nobody is doing anything for me, I got to do something for myself. It really speaks a lot of, especially for the nursing profession, of what more can we do? Like, we have the responsibility, the professional duty to do this, really. We hear the stories our patients go through. We know their struggles, and I don't know any nurse that hears these stories and doesn't maybe sometimes lose a night's sleep about it. What can they do? Or they share it with someone, like, how can we fix this? And there are things we can do to fix it. It doesn't have to just like end there. It's speaking for you, speaking for, in my specialty, speaking for patients who are going through challenges getting their chemotherapy or insurance coverage, or there's no legislation for a certain thing that somebody needs right now. So how can we get that conversation started and what they need? And I don't know if you've done this yet, or if you've been part of any visits like to Congress or state senators or anything like that. I highly recommend it. Again, too, like before 2020, even in 2020, I didn't even think that was an option. I'm like, oh, I can go visit my congressman's office like down the street. And in my case, like, she literally was like down the street, so you can make a visit and
What?
talk to them. And it's a great. Again, too, I thought, I can't do that. Am I allowed to do that? And I had to really get past that thought of, am I allowed to? Do I have to ask permission? Like, I'm not qualified enough. And just know, as a constituent, as a taxpayer, all that stuff, you have the right to speak up and voice like what you need for yourself, your patients, your communities. And people do it all the time. I think that's part of it. Some of the loud voices out there, they might not agree with our worldview. So we're like, oh, that sounds a little off. Those are the people that talk to the senators and congressmen. But then realizing, if you're not talking, you're these kind of people that don't agree with your worldview, they're going to get the stage. They're going to get the congressman, senator, politician's ear. You have to get in there and talk to them and tell them what's going on. And based on, if you're coming in as a nurse, like, you, just the fact that you're a professional in that field, you're a subject matter expert in that. You, as a patient, talking about like insulin pumps and what your experience is, you're a subject matter in that, just because you're going through it, or you've been through it in since the time of diagnosis and all that. They want to hear from you. They have a duty to hear from you. As long as you're having a respectful conversation, going in with a clear ask, then there's so many possibilities that can come from that. when you think about the laws that are made, like every first of the year, all these laws like come into effect, and all these laws are ideas to begin with. Somebody had an idea, found out they had to talk to their local representative or whoever it may be to partner with them, tell them, hey, this is the problem. What can we do? How can I be a resource to you? And this is how we can make our community better. So it starts from that. It's about having conversations. And again, the grassroots movement piece of it, I really feel is where healthcare is going to change. Because I feel like if there's two sides, so like from grassroots, it's like from the bottom up. Because if that's not happening, then you have the top down kind of approach, and people from the higher up are so disconnected with what's happening in like our communities and our lives. It's you might not have an accurate representation
Yeah, I
of
mean,
what's needed or what's happening.
how
Yeah.
often are they on the floor doing rounds, checking on patients,
Yes.
hearing those stories?
Yeah.
I'm sure it's a part of their job to do some amount of that, but they're not going in 50, 60 hours a week, spending time with those
Hmm.
patients and
Hmm.
seeing the PPE shortages or the
Yeah.
medication shortages. Take your
Hmm.
pick. But
Yeah.
yeah, I think that's it. That's why it's got to come from the grassroots and go up, because
Yeah.
we're the ones with the stories, the experience, and to your point, just the expertise. When it's your daily life, you don't have to have a
Hmm.
degree to know needed.
Absolutely. Yeah. Yeah. You're the subject matter in whatever that issue is. And it's the stories that are powerful. I say that a lot. This is one big thing I learned in my advocacy journey and learning how to advocate is the stories have the most impact. You can go in to talk to anyone, whether it be your senator, congressperson, your best friend, and give them a bunch of statistics, unless it's baseball or sports statistics. Those I think hold a lot of weight. But basically, if it's statistics, you can lose the person. But
Right.
if I'm going in and saying, and totally making this up, it's 30% of patients with breast cancer aren't getting this particular medication that's on the market right now, but insurance is not covering it and it costs $1,000 per pill. And in chemotherapy, sometimes the pills and medication is just expensive. And saying 30% of people can't get this pill that's on the market right now. And from those 30%, 50% will die and all that stuff, right? You can have all the numbers. But if you can say, my mom, who's tried every chemotherapy there is, and this is the one pill that might have a chance to give her another year so she can see her granddaughters get married and be there for them. But the insurance company is giving her these hurdles that she has to jump. And so when you're talking to your senator or whoever is making the decision and really humanizing the issue, it's we're telling, hey, this is what we're going through. This is the struggle. Like I need my mom with me for another year and I know this pill can change it, but we're having these problems. When you humanize it and you talk to the people who are making decisions, I think that really spurs them into action because that's what would get me is, wow, what can I do? I hold this office, I hold this responsibility, I have this voice where I can help healthcare. What can I do to help Jelani and her mom or her family member? So that's really what I tell people is stories are powerful. And I'm sure just in the community you have all the stories you've heard that are like probably gut wrenching or just so frustrating. And imagine just repeating or sharing those stories with the people in your community that can make changes. Somebody is going to be inspired enough or really take up that mission to make change. And that happens time and time again with all the laws that are currently in existence right now.
And so, actually, let's walk through a specific
Yeah.
example, because now you've got my mind going and I'm ready to go, because I've already got something that's been riding on me forever. And so,
Yeah.
as a type 1 diabetic, I need external insulin. My body's not producing any insulin internally, and I am relying on that to stay alive. And my doctor owns the ability to give me that insulin. So they have to write a prescription and then I can go get it filled. There have been so many stories of people just desperately reaching out for insulin because they dropped a vial. Like their dog ran into them, they dropped a vial. Their
Yeah.
2-year-old went in the fridge and dropped something. And accidents happen and they can't get in to see their doctor for another 3 months. And
Yeah.
how is that even the world that we live in? That this person will literally die if they don't get a medication, and you're going to make them come in, pay an office visit fee to write the prescription. That's just,
Yeah.
it tears my heart apart when you hear moms talking about
Mhm.
literally driving 5, 6 states away to get an insulin for the next couple of months. That's my issue, and that's what I want to bring a voice
Mhm.
to. Where,
Yeah.
how, what would my process be to start getting people involved? When I go talk to my congressman, do I need to have a list of petitions with support? Does that help? Guide me through the
Sure.
best way to go about, if any of the listeners who I'm sure are going to, everybody's going to pick their own thing and say, this needs change. I have this experience,
Yeah.
my
Yeah.
mom, my grandma, my
Mhm.
loved one,
Mhm.
whoever, we're
Mhm.
all affected by
Mhm.
healthcare. Like you mentioned, it may not be you right now, but
Mhm.
it's a loved one, someone is going through something. So let's like
Mhm.
walk
Mhm.
through the steps of how we change the
Sure.
world.
Sure. There are there are a couple different ways, and I'm just the story just comes to mind right away because a good friend of mine, she was at a little league game for her son, and her I believe it was her representative of Congress was making like an appearance at the game, and she's just totally passionate about advocacy too, and just not shy. So she texted me. She's like, "Oh, my senator is here. Can I just talk to him?" And I said, I if it seems like he's approachable and if the timing's okay, you can talk to them as well. I've done that with one of my local representatives. She was holding like a holiday toy drive, and that's not the venue where you're going to get down into the nitty gritty and say, "Hey, I need this changed right now. What can you do for me?" Because also they're humans too. What would you do if someone you just met from off the street came at you like that? You're going to be like, "Whoa, wait a second, what are you talking about?" You want to present yourself as someone that can be a resource, someone that's knowledgeable, and someone that really is professional, right? And I think whether you're in the healthcare field or just representing your family member or yourself, we know what that is, right? When we ask for something, we know how we should approach people. So that's one way.
So jump
But
out of
yeah,
a dark alley or
yeah,
anything later at
yeah,
night.
yeah,
Refrain from that.
it might not work for anything. But these are a little bit more technical steps, but I want to just break it down because it is as easy as it sounds. You can look up your local representative through a website called congress.gov,
Okay.
and you put in your zip code, and you can see who represents you in the Senate. So you have your federal senator, and you have your member of Congress who are in the House of Representatives. This kind of breaks it down to Civics 101 a little bit. So there are fewer state senators than people who are in the House of Representatives because a representative will represent different regions throughout the state. And you come from a big state, I come from a big state, so we do have more senators and more House representatives in our states. Find out who they are, first of all. And you can actually just click on their website. You want to make an appointment. And depending on the website, because I've seen different things, it can be very like specific where there's a drop down menu and it asks you, what do you want to talk about? Healthcare, infrastructure, things like that. You can choose. It's easy because they want it to be easy for people.
Okay.
Or it's sometimes free type and it just asks you, what do you want to make the appointment for? And it might ask you when your availability is. And if you want to see your Congress member in Washington, D.C., I would say do that a couple months ahead of time because many people want to go to Washington. But it's very effective. I would say even a little more effective visiting your member of Congress in your hometown or in your region because they are people who actually live there. The people in Washington, D.C., they may come from your hometown, but they're seeing people from all over the country sometimes. And if it's your representative from the House of Representatives, they know your town, right? And when you do get that visit, there's a couple things that you need to do is know that you have a time limit. I would say maybe 10, 15 minutes. And that's just because they want to see as many people they can see in a day. You're going to introduce yourself. And one of the biggest things that you can say that will really captivate them, and they know this because you make an appointment with them, is that you're a constituent, you're a voter, or you're representing your community or whatever organization you're representing, because like they want to they're public servants. They want to do what they can for their communities. You introduce yourself as a constituent, and whatever your particular ask is, say a little bit of something of why you're an expert in that ask. So in my case, when I advocate for like chemotherapy related issues, I say I'm an oncology nurse. I've been an oncology nurse for this many years. I work with these kinds of patients, and these are the kinds of issues I see. And for someone going through a healthcare issue or challenge, you can say, I've been diagnosed with this since 95, and I've had to live with this disease, and these are the challenges I have. And it's really about rapport building and relationship building, because you don't think of it as a like a one and done kind of thing, like, oh, I'm going to ask and they're going to take care of it. No, it's about making yourself known to them. I mean, it's like that. If you get like a new neighbor across the street or wherever, you get to know them a little bit. It's about building trust and building that relationship. And it's the same thing, like building that relationship with the teller in the bank, or maybe when you go to the grocery store, if they know who you are, not by name, but they know you, it's the same thing. Because even though you come in with your like your degrees and your titles or whatever, like you're proving who you are as a person and why you want this, why you're advocating for this particular thing. And it might take multiple visits. It's also getting comfortable and speaking with your legislator. And for the most part, they have legislative directors or their staff that will see constituents or will see us when we make the visits, and they are just on top of it. Like they're very knowledgeable about the issues. They're representing their congressmen, congresswomen. So they want to get all the information from you so that they can report it out. And so in my case, I haven't met my actual members of Congress yet. Like on the federal level, I usually meet with their legislative directors, or they have a healthcare liaison or something like that. So they are a little more familiar,
Okay.
but they're just like super bright. When you make an appointment and you list like what you talk about, or if you're representing an organization, sometimes the organization will give a one pager on what the issue is, and they do their research. These are most of the time like really young. Like for me, young is people in their 20s, early 30s, like but just super bright. It's a very competitive field, I feel like, but they want to make a difference as well. And I would even say, don't worry about if you're going to meet with your representative and they're a different political party as you, because you're not going to be talking politics per se. You're going to be talking about a specific issue. And like for healthcare, whether you're Republican, Independent, Democrat, and all that, I would say everyone wants quality healthcare.
Right.
Like when you're asking for quality healthcare, when you're asking for something that can save the life of your family member, honestly, like you hear all this rhetoric in the news, but honestly, are they going to say no to that? Like they want to make their communities better. They want healthier communities, and they want to make sure that they're leaving a good legacy behind. For the most part, right? There's some stories we hear that are out there, but it's really approaching it from an honest place and being like, this is what is lacking in our community. This is what we need. And I know that they're bound by their public service to at least listen to us. Like they may not do something at that time,
Right.
but it's going to be on their radar. Whereas before you talk to them about it, it wasn't on their radar.
Right.
So that's the basic. Make the appointment, go in, have a have an agenda. And again, don't go, what is that term? You don't want to be like super aggressive or super like, I got to have this right now. 'Cause
Guns
then
blazing.
they're not ever going to want to see. Yeah, that's it. They're never going to want to see you again.
Right.
You still always have to be mindful that it's their office that you're visiting,
Right.
and you want to be asked back maybe as a resource, or if something else comes up in the future, you want to be viewed as someone that can be trusted and have like a professional conversation with them. And there's other ways to do it as well. City council meetings, voting is a big way to do it. If you can't picture yourself talking to any of your representatives or going to a city council meeting or anything like that, I think the most basic thing you can do is vote. At least read the issues, be knowledgeable on them, and vote, because that will really impact healthcare. People might not see it, but it ultimately does.
Definitely. And so it was good resource or place to look to know what is being voted on so that you can be educated.
Yes, there's different resources, and I guess it depends on the region that you're living in. But sometimes, because they want people to be informed voters, when they're sending out the ballots and things like that, the issues are in there.
Okay.
But also aligning yourself, like when something is up for a vote and you get the I'm forgetting the name of it, but I know like I'll get something in the mail and it will say what the issues are that are up for a vote. And I'm not just talking about presidential elections. That's a super big election, but there's so many smaller elections that happen throughout the year or that kind of go under the radar. And before you know it, something turned into a law and you're like, "Oh, I didn't even know that was up for a vote." Signing up for newsletters, if there's a professional organization or a patient advocacy organization that you know deals with your issue, sign up for their newsletters, because they will just distill or they will like tailor the content specifically for what you're interested in.
Right. Okay.
And I'm going to give example of the Oncology Nursing Society is that they have a legislative director. And I would say most organizations, they do have a legislative director that looks at laws that would affect their patient population or their mission, and they will send it over to their members, like whoever signed up to learn more about it. And if there was a piece of legislation that was up for debate right now in whether the state level or federal level, and for those like petitions and letter writing campaigns, those are helpful because before the politicians can make their final decision, they want to hear from their constituents. They want to hear who it's affecting. And so maybe back in the day, like when they say letter writing campaign, like you would have to write a letter
Yep.
and mail it in or email it in. But it's so easy now. For example, for nursing, there's something called the Workplace Violence Act, where the American Nurses Association was trying to help pass this law where it would make it a federal crime if a nurse or healthcare worker was assaulted on the job, much like with airline workers, like
Hmm.
if you assault them on a plane, it's a federal crime. There's a piece of legislation like that was going through, making its rounds through Congress. They were encouraging nurses to support it, and basically they sent out this email. It was like a form where you put in your name, address, your zip code, so that way it can route to whatever region you are, whoever your politicians are, and you click send, and it was like a template, a form. Like you really didn't have to do anything. You just added your name to that form. It sent it to your senator directly,
Wow.
and then they follow up with you. The senators' offices might have like a template reply, like a thank you, but they
Hmm.
will follow up and say thank you for sending your letter. So it's easier than what you may think it is, but it's just getting to know where to start and asking questions and partnering with people. And that's how I started. Again, I had no background in this, but through the nursing associations I joined, through other nurses that were interested in doing the same kind of work, and just really putting yourself out there and saying, okay, what can I do? How can I do? How can I do this? How can I help? Someone will always, I feel like, reach out to you and say, hey, this is how you can help, or this is how you can join the movement to make things better. And then from there, you start building a community just like this, just through social media. We connected, and I was really interested in your mission and seeing how can I help? How can we partner to get your message out there? And it just grows from there. Everything starts from something, right? Let's start good things together.
Yeah. And I think a big takeaway is that you don't have to start a YouTube channel or philanthropy or anything like that.
Mhm.
I think the first step is just becoming educated when going out
Mhm.
and voting, knowing what's going on, and just even just casting that ballot, putting in your vote. That's a voice.
Mhm.
That's one more voice than there was
Mhm.
before. Just being
Mhm.
able to send out the educational know-how, I think, is a huge step and something I'm really thankful that you're doing. because I think I've learned
Yeah.
more talking to you today than I did in my 8th grade history class
Oh,
and all that. So I appreciate you.
I do have to say, and again, with no background in this, and I'm sure we learned it in elementary school, or at least in my generation, like Schoolhouse Rock, like that was like I was their target audience back in the 80s there. So I don't remember any of it, the melodies maybe, but even so, it's how does that like pertain to me? I had to really learn all about this again because I went to nursing school to be a nurse, not to be a political scientist or something like that. And it's so interesting because the information is just out there. So I would Google things and I read books, and like most of these books were like scholarly books, but I'm like, no, that's not like the information I need. I just need to know like the basics.
Hmm.
And that's like how I started my Instagram was Civics 101 for healthcare. So it's just like the basics, like how does a bill become a law? What does bipartisan mean? How many terms does a senator have? How many terms does a member of Congress from the lower house, how many terms do they have to serve? And I had to just really look at the books that were most helpful to me were like 5th grade history, civics books, because it broke it down for you. But also, if you go to your state legislative site or even the federal legislative site, there's just the information's all out there, like how a bill becomes a law. What do these terms mean? Because they want informed citizens, they want informed voters. And it's really helpful because I think in our day to day we forget how things work. But always remember there's people that know these rules, right? Like the back of their hand, and they're going to be the ones that are going to be getting the edge and getting to the front of the line, so to speak. We have to arm ourselves with that knowledge and know the basics. And just a big part of it is knowing where to start. Know who your Congress member is, who represents you in the state government, in the federal government, in your local community, because it's also going to the right person to ask. So that's like the mom and dad kind of thing. You know what to ask your mom to get a yes, what to ask your dad to get who to ask, right? So like you're not going to go to whoever your politicians are if you have a problem with the like a pothole on your street. You're not going to go to, your congressman in Washington D.C. to talk about that. You're going to go to someone more on the local level.
Right.
You mentioned, the insulin your doctor couldn't prescribe, or maybe because they were bound by their regulations that they couldn't prescribe more than they could, even though they wanted to help you
Right.
based on insurance and all that stuff. You're not going to your city council member for that. That you're going to who oversees the medical board, who oversees the insurance companies in your state. And if that's not where you're going to get your answer, then you might have to go beyond that. It does take work, but it's needed. It's really needed because it's your health. You know what you're going through, you know what your family member is going through. And again, if not you, are you going to just rely on that person you're talking to at the insurance company? I'm not saying that they're not passionate about their job, but it is a job for them,
Right.
right? As much as they want to help, they might be replaced. If you make a great connection at the insurance company or at your doctor's office, who's to say they're going to be there next week, right? They might quit or they might be replaced or promoted, right? And it is a long process sometimes. Sometimes it's not, sometimes it is. Some people say it's a marathon, but it has to start from somewhere. And I think in our society now, we're used to like quick results. Everything is like Amazon Prime. Can get to us in a couple days. But with bigger issues like this, knowing how the system really works and not getting frustrated and giving up is going to carry you a long way, because there are many times where you're like, my voice doesn't matter, or my vote doesn't really count. But when you're looking at the bigger picture, the grand scheme of things, it really does. It really does. That's what the easiest way to get involved is know who represents you in government and register to vote and vote on the issues that matter to you. And if it's, again, too, I think everyone, doesn't matter what political affiliation they're identified with, is quality healthcare is like a no-brainer. We all want that for ourselves, for our patients. And also, too, I just wanted to call out there, like in my platform, I really want to stress like the bipartisan or the It's not about, I don't represent, like in my platforms, I don't represent like a political view or political side, because I just want people to vote. I just want people to be knowledgeable. Your view can be different from mine. And that's what this country is, right? It's made up of different views. And so we have to protect each other's rights to our views and our votes. It's just getting in there and vote. And if your vote's different from mine, that's how our political process, that's how democracy works.
Right.
But just get in there. You have to get in there. You have to get in there and vote or register to vote. A lot of people aren't even registered. And it's August still. So August is Civic Health Month. There's a couple of organizations that are trying to get traction on what Civic Health Month is, what we do in Civic Health Month, and basically it's just educating people that voting is associated to healthcare, and you have to register to vote. You have to actually vote. These ballot measures come up. But there was an interesting statistic that was what I saw. So the amount of unregistered voters that we have in this country is equal to the total population of France. And I think it was like 72 million. And those are just people that don't vote
Yeah.
because they're not registered to
They
vote.
even if they
And
wanted
most
to, they
people, yeah,
couldn't. Even if
they
they
couldn't.
showed
Yeah.
up, they couldn't.
Yeah,
Wow.
they couldn't. Yeah. Yeah. So those are just people who are eligible to vote. Like they can totally vote, but they just don't register. And again, people are busy in their lives. They forget that they should register, or like they miss dates on when to send in their ballots. That happens. But for those of us that know that these votes, these voices matter, I think it's also our responsibility to get the word out there. Check your voter registration. This is the website you go to check that, and raising awareness. And there can be like really powerful relationships between healthcare, people in healthcare, and patient advocates, because you have one side that is in the system and knows how to navigate through that system, and yet on the patient side you have the stories and the struggles and knowing what you have to navigate through on your side in order to get what you need. So it's two pieces to a puzzle. It just forms a much more powerful alliance. It really paints a clearer picture of what's going on, and there's a lot of power in that. There's a lot of power in that.
There is for sure. And that's why I'm so happy that we ended up just crossing paths on Instagram and now we're
Yeah.
here. I know that your platform is focused on a lot more than just patient advocacy. I can express my gratitude for you and what you're trying to do for patients. I know you're working for working conditions training. There's a lot more that your platform is encompassing for nurses. So I thank you for giving us a seat at the table inside your platform for advocacy. It's really refreshing to know that there are people out there who are trying to make a difference, even if they're not the ones directly impacted with a chronic disease or cancer or something like that. I thank you for that.
No, I am just so very passionate about it, because I say this, it's a little cliche, but I feel like when nurses win, we all win, because nurses are there to walk the healthcare journey with you. And we see patients at their lowest moments in their health journey, whether it be emotionally, physically, mentally, and we're the voice for them. So, again, when we as a profession have the tools and the resources, we can take care of you, everybody wins from that. And again, not to discount the other disciplines in healthcare, but again, with what happened in 2020 in the pandemic, we have to do it for ourselves. There's nobody to rely on except for us. And one of my guiding principles is what nursing went through during the pandemic, where nurses were dying, nurses didn't have a voice. Very few nurses were on the news or in media telling people what was happening, because we were like all so busy taking care of patients, but we all have to have a voice out there as well. Or they were asking people that may not have been on the front lines. So my mission is to get the word out there so nurses are empowered and advocate, so that we're never in that same situation again. I never want nurses in the future to go through what nurses in 2020, 2021, 2022 went through. There were not just people dying, but also people leaving the profession. In 2020, there were 6.5 million. Currently, there's 4.5 million. And there's nurses I still speak to every day where they're like, oh, I don't know if this is the field for me. Especially our younger nurses. Like these were 22, 23-year-olds, like straight out of nursing school, coming to work, working with a disease that had no cure. And they were like scared. And like my hats are off to them. And they're the ones I want to empower and retain in the profession selfishly because I want to make sure that the nursing workforce is strong and educated and have the resources they need. But yeah, like I was saying earlier, grassroots is the way to do it because we need a better system for all the wonderful innovations there are in this country. Healthcare is nowhere near where it needs to be. And it broke my heart earlier, people having to drive different states just to get the medication they need. And it shouldn't be like that.
And that's
Like it shouldn't be like that.
going to find someone who's stockpiled enough to have extra. That's not getting
Yeah,
a prescription or anything like
yeah,
that. I
yeah,
completely
yeah,
agree. That's just not how anyone
yeah,
should have to live.
yeah. And this is a conversation for another day, but you might be experiencing it in your region. Is a lot of pharmacies are closing down, so
Hmm.
there's like pharmacy deserts, right? Here in California, we have CVS, Walgreens. I'm sure all over the state, but lots of them are closing down. So people are having to drive farther. They have less options. Or even if you drive, if you've experienced it before, you want to call ahead first, make sure that they have it. But some people just think, oh, that pharmacy, they should have it. But then you're driving 2 hours somewhere and they didn't have it.
Right.
That's like the learning curve of it. And that's another thing too. The people that are making the laws, or they might not know that in your community you have to drive 50 miles just to get a prescription filled. Because in their community, it might be different, right? They have a CVS on every corner, right? Pharmacy on every corner, but in your community, you don't. So it's about bringing to light the disparities that there are, people that are having challenges and what those challenges are, so that we can improve things. And again, things that we're talking about just don't happen in the hospital, right? They happen at the doctor's office, at the pharmacies, at the insurance companies, all of that. Sometimes in school, right? If you have children in school that need their medications, like what kind of regulations does that school district have for storing the medications? There's so many different things that you don't think might affect you,
Hmm.
or you think, oh, that's just politics. But when you start bringing it home about how does it affect your kids in school? How does it affect you at work? Everything does rely on laws and how things are regulated. Even clocking in and out for work, right? If you don't take your lunch by a certain time, there's all these rules and regulations for that. You can't say, I want to stay out of politics, or that's none of my business, but you are definitely its business. So you have to be knowledgeable and be aware.
I totally agree.
Yeah.
I had a list of things to talk through, and you just went through all of them. I'm literally looking at it, and I think you touched on everything that I wanted this conversation to hold. Is there any closing thoughts, anything you want to just broadcast and make sure that people take home with them from this episode?
Yes, I really want people to know more about like your platform and your voice. And I'm going to share that with my platforms and whatever I can do to partner and help. I want to do that because we're all in this together, and it takes several conversations, not just one conversation, to make change. That's really what I wanted to call out. I learned so much about you just in this conversation. And instantly, like, my feeling was, what can I do to help? What more can I do? So I would be happy if you can use me as a resource for anything or anything like that. I would be very happy to help you with your advocacy journey and improving the lives for type 1 diabetics.
And right back at you. Like you mentioned, it's going to be grassroots. It's going to be the patients impacted and then the people that know how to navigate the system.
Yeah.
It's going to be a group effort for sure. So I'm extremely happy that we've come across each other's paths, and I'm excited to keep working and talking with you.
Thank you so much, Josh. Thank you for what you're doing. You're doing great work. And the power of social media and getting your content out there. You just never know who it's going to reach. Also, too, just to add, a lot of our politicians are on social media. So if they're using it as a platform, then we should use it as well, because that's how you're going to share your message.
I agree. It's a great point.
Yeah. Yeah.
Well, I'm sure we'll have you back. Maybe as
Oh, yeah. I'd be
election
happy
time
to.
comes closer, or if it's just giving updates, we're here for each other at this point now.
Oh, yeah. Absolutely. Thank you so much, Josh.
Thank you. Appreciate it. Thank you for joining us on this episode of Rebel Health Collective. I hope that today's discussion with Gilanie has inspired you to take action and become an advocate for better healthcare. Remember, every voice counts in transforming our healthcare system, from the front lines to the legislative halls. If you have a story to share or expertise to offer, we'd love to hear from you. We're always looking for new guests to join us on the podcast and contribute to the important conversations. Check the link in our show notes to set up a time to meet with us. We'd really be honored to amplify your voice. Don't forget to subscribe, leave a review, and follow us on Instagram and Facebook at Rebel Health Collective to stay connected with our community. Until next time, keep up the fight, don't back down, and stay rebellious. Take care.